Starting with news from China, for the first time in 3 years, China has reported no new COVID-19 deaths, and that is because the country's National Health Commission has stopped publishing daily COVID-19 numbers. This despite Beijing struggling with the surge in COVID-19 numbers, and the decision to scrap the daily virus count comes amid concerns that the country's blooming wave of infections is not being accurately reflected in official data. China has also narrowed the criteria by which COVID-19 fatalities will be counted. Under China's new definition of COVID deaths, only those who die of respiratory failure are counted. Those who die of pre-existing conditions exacerbated by the virus will not be counted. Health authorities have now warned that infections would hit an apex in early January, and the wave of infections would last for about 3 months. China, which has ended long quarantines, compulsory testing, is now experiencing its first ever national COVID wave, with hospitals in the country being overwhelmed. Meanwhile, people in China are now learning to live with the virus. Beijing and Shanghai, which are China's two biggest cities, moved closer to living with COVID-19.
有做好跟疫情共存的准备，毕竟封闭也不是长久之计。我们可能之后春节的时候也会再爆发一波嘛，那时候还是要共存一下。
For the first time in 3 years, China has reported no new COVID-19 deaths, and that's because the country's National Health Commission has stopped publishing the daily COVID-19 numbers. This decision to scrap the daily virus count comes amid concerns that the country's new wave of infections is not being accurately reflected in the official data. China has also narrowed the criteria by which COVID-19 fatalities are counted. Under the new definition of COVID deaths, only those who die of respiratory failure are counted. For more on this now, we're now being joined by Andrew K.P. Lung, an international affairs expert from Hong Kong. Thank you so much for joining us. Now, my first question to you, China is witnessing a surge in COVID cases. The official data, as I mentioned earlier, does not reflect the true scale of infections. What would you say about that?
Well, China is now in the midst of the world's largest and most rapid dramatic transition from a pandemic hopefully into an endemic, in the sense that the variants are, although much more infectious, are highly less deadly compared with the previous virus when it first appeared. And then China has been practicing this very stringent regime of dynamic zero strategy, right. Relatively successfully in containing the number of deaths. But now it's been 3 years and people's patience are wearing thin. And then the pandemic is changing significantly, from a deadly pandemic into a less deadly but more infectious endemic. So according to the latest data, as many as 17% of China's population, don't forget China has got a fifth of mankind on the planet, 14 billion people. And then as many as 250 million people were infected during the first couple of weeks in December. Well, this shows that the virus is spreading and more infectious as the strict lockdown regime has been totally and suddenly relaxed. People are not used to this because they relied previously on the government's compulsory testing, and now they are required to self-test. And then a lot of these self-tests are not reported, or because they are not required to. And in any case, they are less accurate. And hence, the government finds it very difficult to release any more data which can be regarded as reliable. Right. But then, on the other hand, instead of the Beijing central government reporting on these cases, the responsibility has been delegated to lower-level departments. It doesn't mean that they're hiding the data. It's just that the data are no longer as reliable as they were. But then, on the other hand, the government found itself not as well prepared as they should be in preparing the population for the sudden change, and also stocking up necessary ordinary medicine supplies which can suppress fevers and things like that. And this is a mass outbreak of a huge kind of flu. Of course, it's more infectious than flu,
right.
and statistically even more deadly as amongst the elderly population, because
right.
the elderly population, the vaccination rate has been relatively low. But
right.
even though low doesn't mean that they have not been entirely, sort of vaccinated. According to the latest data, as much as 70% of those over 60 have had 3 doses already, but they're still not high enough.
Right. In fact, I was just going to come to that.
Yeah.
How would you assess the impact of this on communities that lack critical infrastructure and the vulnerable populations in China, like you just mentioned? Natural immunity nearly non-existent, and also we've seen vaccine hesitancy has remained stubbornly high among the older population here.
Well, in fact, China has never used the American mRNA vaccine. Has been relying on its own vaccine right from the very start. One of the earliest the government's developing these vaccines, and so far that the effect has been relatively successful. Even according to the independent research institution called Edelman Trust Barometer, EDELMAN, based in New York, and they surveyed countries around the world in the beginning of this year, and they found that China came up tops in terms of government support of their management of the pandemic. But it's been 3 years, and then the pandemic has been changing into an endemic with a tsunami of infections, and then the government has not had as prepared as they should be in terms of preparing the population as to what to do in these circumstances, and also not enough ordinary medicine supplies. But suffice to say that all these years, during the 3 years, the government has built a lot of temporary hospitals, thousands of them, sort of cabin hospitals to cope with the emergencies. And then, of course, one should not underrate the government's ability to mass mobilize resources and people to deal with any emergency.
All right.
But chances are that this situation, this uncertainty and kind of nervous situation is likely to carry on for the next couple of months before it's expected to stabilize, maybe in the beginning, in the first quarter of next year. And by all token,
right.
It seems that the economy is now returning gradually and in some places quite rapidly to normal. But the challenge is that a lot of people are moving to visit their homes during the Chinese New
Right,
Year.
absolutely.
Usually known to be the humankind's massive annual migration to the countryside, and
right.
the countryside much less well prepared. So the challenge is there for the village officials and village authorities to manage this. But on the plus side, though, the people's sense of vigilance has been heightened because of all these recent happening couple of weeks. The challenge is whether the villagers would have enough ordinary medicine to suppress fevers and so on and so forth.
All right, Mr. Andrew Kapelang, thank you so much for joining us on this podcast with all your insights on this. WION is now available in your country. Download the app now. Get all the news on the move.